Your dog starts vomiting at 11 p.m. on a Saturday. Your cat's been hiding under the bed all day and won't eat. Your puppy just swallowed something they definitely shouldn't have. And suddenly, you're staring at your phone wondering, do I need to rush to the emergency vet right now? Or can this wait until Monday morning when my regular vet opens? Get that call wrong and it could cost your pet their life or cost you thousands of dollars you didn't need to spend. My name is Kenji Takahashi, and while I spend most of my time working with aquarium ecosystems, I've learned the hard way that emergency preparedness works exactly the same whether you're dealing with fish, dogs, cats, or any other animal you love. You're listening to Total Pet Parent Podcast. Quick thing I want to mention up front. Everything you're about to hear is researched, fact-checked, and written by real people who actually know what they're talking about. But the voice delivering it is AI-generated. Just wanted to be transparent about that from the start. If you've been listening for a while, seriously, thank you for being here. You could listen to anything and you keep coming back to us, and that's not something I take for granted. If this is your first episode, hey, welcome aboard. You're in good company. We drop new episodes every Monday, Wednesday, and Friday, covering everything from the basics to those 2 a.m. panic moments where you're Googling, is this an emergency? Speaking of which, let's get into this one. Most pet owners actually need both types of veterinary care in their lives. You need a trusted, regular vet for preventative care and routine health management, and you need a reliable emergency vet location identified ahead of time for those gut-wrenching moments when something goes seriously wrong. Understanding the difference between emergency vet and regular vet services could literally save your pet's life. In my experience helping aquarium hobbyists with fish emergencies over the years, I've learned that the same principles apply across all pets. Preparation beats panic every single time. This guide will walk you through exactly when to use each type of veterinary service, what to expect from both, and how to build a complete healthcare plan that keeps your dog, cat, or other companion animal safe without unnecessary stress or expense. Let me give you a quick comparison to set the stage. Emergency vets are available around the clock, nights, weekends, holidays, all of it. Your regular vet typically operates during business hours, maybe weekdays plus some Saturday mornings. Emergency vets handle life-threatening conditions, severe injuries, and acute illness. Regular vets focus on preventative care, routine checkups, managing chronic diseases, and minor illnesses. The cost difference is dramatic. Emergency care typically runs 2 to 4 times higher than regular vet care, with emergency fees alone usually hitting somewhere around $100 to $200 just for triage before any actual treatment starts. Regular vet consultations usually cost $50 to $100, depending on where you live. Emergency visits are one-time encounters where the records get sent to your regular vet afterward. Regular vet care gives you that ongoing relationship, complete medical history, and familiarity with your specific pet. Wait times work differently too. Emergency clinics use triage, meaning critical cases get seen immediately while less urgent cases might wait hours. Regular vets work by scheduled appointments with predictable timing. And staffing differs too. Emergency hospitals are often staffed with emergency and critical care specialists with advanced equipment, while regular clinics have general practitioners who may refer complex cases to specialists. Now, let's talk about hours of operation and accessibility, because this is where most pet owners first learn the distinction, usually at the worst possible moment. Regular veterinary clinics operate on schedules designed for routine care. We're talking Monday through Friday, usually something like 8 a.m. to 6 p.m., with some offering Saturday morning hours. What I've found through my own pets over the years is that this works beautifully for annual wellness exams, vaccination updates, dental cleanings, and those I've noticed something slightly off but it's not urgent appointments. Your regular vet is where you build that relationship. They know your senior cat has early kidney disease. They remember that your Labrador has a grain sensitivity. They've got 15 years of medical records showing baseline blood work values that become incredibly valuable when interpreting new test results. But here's the thing. Pets don't schedule their emergencies. My friend's boxer started bloating on a Sunday night around 9 p.m. Gastric dilatation volvulus, which is a life-threatening condition where the stomach twists and fills with gas. Regular vet? Closed. No voicemail option for after-hours emergencies, just a recorded message directing callers to the nearest emergency clinic. Emergency veterinary hospitals exist specifically to fill that gap. They're staffed around the clock, 7 days a week, 365 days a year, with veterinarians, vet techs, and support staff ready to handle critical cases at 3 a.m. on Christmas morning just as readily as Tuesday afternoon. Many emergency clinics operate as standalone facilities, while some are affiliated with larger veterinary hospitals that transition from regular daytime service to emergency-only coverage after hours. The trade-off is that you won't see the same veterinarian who knows your pet's quirks and history. You'll see whoever's on shift, and they're meeting your pet for the first time in crisis mode. In my experience, the smartest move is identifying your nearest emergency vet clinic before you need it. Save the address in your phone, do a practice drive so you know exactly where you're going when panic sets in. After what to do when your pet is choking or another emergency situation, every minute counts. Fumbling with Google Maps while your dog struggles to breathe is not the time to figure out directions. Moving on to the types of conditions treated and scope of care, because understanding which conditions warrant emergency care versus regular veterinary attention is genuinely one of the most important distinctions pet owners need to grasp, and it's not always as obvious as you think. Regular veterinarians handle the full spectrum of non-emergency care. Annual wellness exams for dogs and cats of all ages, puppies, adults, seniors, vaccination protocols including core vaccines like rabies, distemper, parvovirus for dogs, or rabies, feline viral rhinotracheitis, calicovirus, and panleukopenia for cats, plus lifestyle-appropriate non-core vaccines, parasite prevention and treatment, dental cleanings, minor skin conditions, ear infections, urinary tract infections in stable patients, chronic disease management like diabetes or hypothyroidism, nutritional counseling, behavioral consultations, minor lacerations that don't require immediate attention, and elective surgeries like spays, neuters, and mass removals that you schedule in advance. What I've found works for most pet owners is thinking of your regular vet as your primary care physician, the professional you see for checkups, the person who knows your pet's baseline normal, the first call you make when something seems off but doesn't feel immediately life-threatening. When my elderly cat started drinking slightly more water than usual, I scheduled a regular appointment for blood work to check kidney function and blood glucose. Not urgent, but worth investigating. That's regular vet territory. Emergency veterinarians focus on critical, life-threatening, or severely painful conditions that can't wait for business hours. Difficulty breathing or choking, suspected poisoning or toxin ingestion. And this is a huge concern when you consider pet poison control, common household toxins, and how many everyday items are actually dangerous. Severe bleeding that won't stop with direct pressure, seizures, especially first-time seizures or clusters, inability to urinate, particularly critical in male cats with urinary blockages, suspected bloat or GDV in deep-chested dogs, severe trauma from vehicle strikes or falls, heat stroke, snake bites, eye injuries, difficulty giving birth, sudden paralysis or inability to walk, ingestion of foreign objects causing obstruction, severe allergic reactions with facial swelling or hives. According to the American Veterinary Medical Association, roughly 25% of emergency vet visits could have waited for regular veterinary care, while about 10% of problems that pet owners initially dismiss as minor actually required emergency intervention. The gray area is real. My rule of thumb, developed through years of evaluating sick fish and learning to distinguish "keep a close eye on this" from "act right now." If you're genuinely questioning whether something is an emergency, it's worth at least calling the emergency clinic and describing the symptoms. They can help you triage over the phone, and I've never met an emergency vet tech who minded a concerned owner calling to ask. Pet emergency care and what every dog and cat owner needs to know provides a fuller picture of this decision-making framework, but the short version is this: trust your gut. When in doubt about severity, err on the side of caution. Now, let's talk money, because the financial difference between emergency vet and regular vet care can genuinely shock people who aren't prepared. And I think being honest about costs is part of responsible pet ownership. Regular veterinary visits operate on a fairly predictable fee structure. A standard wellness exam for dogs or cats typically runs around $50 to $100 depending on your geographic location. Urban areas trend higher. You've got additional costs for vaccines, usually around $15 to $30 per vaccine. Fecal testing, around $25 to $50. Heartworm testing for dogs, around $35 to $50. Routine blood work for senior pets, around $100 to $200 for a complete panel. Elective procedures are quoted in advance. You'll know before scheduling that space surgery will cost around $200 to $500, depending on the animal's size and sex, or that a dental cleaning runs around $300 to $700, depending on the extent of dental disease and whether extractions are needed. The predictability is what I value most about regular vet care. You schedule the appointment, you know approximately what it'll cost, you budget accordingly. Even unexpected findings, like discovering a heart murmur during a routine exam, lead to structured diagnostics with estimates provided before proceeding. Emergency veterinary care follows a completely different financial model, and this is where pet owners sometimes experience sticker shock. Most emergency clinics charge an emergency or after-hours fee just for walking in the door, usually around $100 to $200 before any actual treatment begins. That's triage, getting your pet evaluated to determine the severity and urgency of the condition. From there, diagnostics and treatment stack up fast because emergency cases often require immediate imaging. X-rays around $200 to $400, ultrasound around $400 to $600, urgent blood work around $150 to $300 for emergency panels, IV catheter placement and fluid therapy around $100 to $200, oxygen therapy, emergency medications, hospitalization, anywhere from $100 to $300 per day for basic monitoring to $200 to $500 plus per day for intensive care with constant supervision. I learned this the hard way when my dog ate a corn cob and developed an intestinal obstruction. Emergency visit on Saturday night, $150 emergency fee, $250 for x-rays, $180 for blood work, $500 for IV fluids and overnight monitoring, $2,400 for emergency surgery to remove the obstruction, $300 for postoperative pain management and antibiotics. Total bill? Roughly $3,800, paid in full before we could take him home. My regular vet would have charged maybe $1,500 to $2,000 for the same surgery scheduled during business hours, but my dog didn't have the luxury of waiting until Monday morning. The honest truth is that emergency veterinary care costs 2 to 4 times what the same treatment would cost during regular business hours, and you typically need to pay up front or have approved credit. Many clinics work with services like Care Credit or Scratch Pay for payment plans. This isn't price gouging, it's the reality of maintaining around-the-clock staffing with specialized equipment and emergency-trained veterinarians. But it's also why pet insurance or a dedicated emergency savings fund becomes genuinely important if you want to avoid making medical decisions based purely on what you can afford in that moment. Most regular veterinary clinics offer wellness plans or payment options for routine care, and they'll work with you on payment arrangements for unexpected findings. Emergency clinics generally can't extend that same flexibility because they're seeing you for the first time in a crisis situation. Let's talk about medical records, continuity, and follow-up care. This is an aspect of emergency vet versus regular vet services that doesn't get enough attention, but it makes a huge difference in long-term health outcomes for your pet, particularly if they develop chronic conditions or need ongoing management. Regular veterinarians build comprehensive medical records over years of caring for your pet. They document every vaccine, every illness, every physical exam finding, baseline laboratory values from wellness blood work, weight trends, behavioral changes, medication responses, surgical histories. What I've found through managing my senior cat's chronic kidney disease is that having 5 years of blood work results to compare against current values gave my vet the ability to spot subtle deterioration months earlier than if she'd been looking at a single snapshot. She knows my cat's normal kidney function looked borderish even when he was young, so she's not alarmed by values that might concern a vet seeing him for the first time. That continuity extends to familiarity with your pet's temperament and handling needs. My vet knows my cat requires gabapentin pre-medication before visits because he's fear-aggressive, and she's learned exactly how to approach him to minimize stress. She remembers that my dog has a history of vaccine reactions, so we pre-medicate with diphenhydramine and monitor for 30 minutes post-injection. These details matter for quality of life and medical accuracy. Regular vets also provide structured follow-up care. If your dog develops a skin infection, your vet examines them, prescribes antibiotics, and schedules a recheck in 2 weeks to confirm resolution. If your senior dog is struggling with weight management, understanding how to help your senior dog lose weight safely becomes an ongoing conversation with monitoring visits every 4 to 6 weeks. Emergency veterinarians operate in snapshot mode by necessity. They meet your pet in crisis, stabilize the immediate problem, and document their findings. But then your pet goes home and the emergency vet typically never sees them again. They'll send detailed discharge instructions and medical records to your regular vet, but they don't provide ongoing management. If your dog needed emergency surgery for a foreign body obstruction, the emergency surgeon will remove it, manage immediate postoperative pain, send you home with medications and wound care instructions, and direct you to follow up with your regular vet in 10 to 14 days for suture removal and healing assessment. This handoff works well when both sides communicate properly, but I've seen gaps. After my dog's emergency corn cob surgery, the emergency clinic sent records to my regular vet, but there was confusion about which antibiotics he'd been started on and at what dose. My regular vet had to call the emergency clinic for clarification before continuing the prescription. Not a disaster, but it illustrates the inherent challenge of fragmented care. For pets with complex medical conditions, this fragmentation can become genuinely problematic. If your diabetic dog goes into hypoglycemic crisis at 2 a.m. and you rush to the emergency vet, they'll stabilize blood glucose and send you home. But adjusting the insulin protocol and figuring out why the crisis happened in the first place falls to your regular vet at a follow-up appointment. The emergency vet handled the immediate life threat. Your regular vet manages the underlying disease. In my experience, the sweet spot is using both services as they're designed, emergency care for crises, regular care for everything else, and making absolutely sure your regular vet receives complete records from any emergency visits so they can incorporate that information into your pet's long-term care plan. Now let's talk about staffing, specialization, and equipment capabilities. The professionals you'll encounter and the resources available differ meaningfully between emergency vet and regular vet settings, and understanding these differences helps set appropriate expectations when you're stressed and worried about your pet. Regular veterinary clinics typically employ general practitioners, veterinarians with a Doctor of Veterinary Medicine degree who are trained to handle the breadth of companion animal medicine but aren't specialized in any particular area. In larger practices, you might find veterinarians with special interests, one doctor who particularly enjoys dermatology cases, another who handles most of the dental procedures, but they're still technically general practitioners unless they've completed board certification in a specialty, which is uncommon in standard small animal practice. The support staff includes licensed veterinary technicians or certified veterinary technicians, depending on state credentialing, veterinary assistants, and front desk and administrative staff. Equipment-wise, most regular vet clinics have X-ray machines, basic in-house laboratory equipment for blood work and urinalysis, ultrasound, increasingly common but not universal, dental equipment, surgical suites for routine procedures, and oxygen support. They can handle diagnostics and treatments for the vast majority of conditions that walk through their doors. But truly complex cases, things like advanced imaging such as CT or MRI, specialized surgeries, or intensive care requiring constant monitoring, get referred to specialty or emergency hospitals. Emergency veterinary hospitals tend to have more specialized resources, both in terms of personnel and equipment. Many are staffed with board-certified emergency and critical care veterinarians, diplomats of the American College of Veterinary Emergency and Critical Care, who've completed additional residency training specifically in emergency medicine after their general veterinary degree. Not every emergency vet is board certified. Plenty of excellent emergency veterinarians practice without specialty certification. But the presence of specialists reflects the complexity of cases these facilities handle. The equipment at emergency hospitals often includes advanced diagnostic imaging like CT scanners, sometimes MRI access. Ultrasound with specialists trained in emergency abdominal and cardiac ultrasound protocols for trauma assessment. More sophisticated laboratory equipment for rapid blood work turnaround. Ventilators for respiratory support. Blood banking capabilities for transfusions. Intensive care units with continuous monitoring. Surgical suites equipped for complex emergency procedures. Some large emergency hospitals also have access to specialists in other fields, internists, surgeons, cardiologists, neurologists, either on staff or on call. What I've found when I've needed emergency care for my pets is that the specialization cuts both ways. Emergency vets are incredible at stabilizing acute crises. They've seen countless blocked cats, bloat cases, toxicities, and traumas, and they work with practiced efficiency to address immediate threats to life. But they're not necessarily better than your regular vet at managing chronic skin allergies or fine-tuning thyroid medication doses. Different skill sets for different purposes. The nursing staff at emergency clinics also tends to be specially trained in critical care, comfortable with tasks like managing patients on IV fluid therapy, monitoring anesthetized patients during emergency procedures, providing oxygen support, and recognizing subtle signs of deterioration in hospitalized patients. In my experience, the vet techs at emergency clinics are some of the most competent, unflappable professionals in veterinary medicine because they've chosen to work in an environment where every shift brings unpredictable, high-stakes cases. So who should choose emergency vet services? You should head to an emergency vet immediately, no hesitation, no let's wait and see, if your dog, cat, or other pet is experiencing any clearly life-threatening or severely painful condition that cannot safely wait several hours for treatment. Specific scenarios that warrant emergency care right now. Difficulty breathing, labored breathing, blue or gray gums, gasping, choking that you can't resolve with back blows or the Heimlich, suspected poisoning or toxin ingestion of any kind, uncontrolled bleeding that persists despite direct pressure for several minutes, Seizures lasting more than 2 to 3 minutes, or multiple seizures close together. Inability to urinate, especially male cats straining in the litter box. This is a true emergency that kills within 24 to 48 hours if untreated. Suspected bloat in deep-chested dog breeds, distended hard abdomen, unproductive retching, obvious distress. Severe trauma from being hit by a car or falling from height. Collapse or sudden inability to walk, especially in the hind legs. Extreme lethargy, where your pet won't respond to their name or food. Heat stroke symptoms, heavy panting, drooling, bright red gums, collapse after heat exposure. Eye injuries or sudden vision loss. Severe allergic reactions with facial swelling or widespread hives. Snake bites. Labor complications where your pet has been actively pushing for more than 30 to 60 minutes without producing a puppy or kitten. Ingestion of foreign objects you know are dangerous, things like corn cobs, cooked bones, toys, strings, or batteries. You should also use emergency services when your regular vet is closed and something happens that's causing genuine pain or distress, even if it's not immediately life-threatening. A dog who tore a toenail completely off at 11 p.m. on Saturday isn't going to die from it, but they're in real pain, and the exposed quick is vulnerable to infection. That's an appropriate emergency visit, even though it could technically wait until Monday if you're willing to let your dog suffer through the weekend. Who should choose regular vet services? You should schedule an appointment with your regular veterinarian for essentially everything that doesn't fit the emergency criteria I just described. And honestly, that's the vast majority of veterinary care throughout your pet's lifetime. Regular vet visits are appropriate for annual wellness exams, every 6 to 12 months depending on age, and senior pets benefit from twice-yearly checkups. All vaccination schedules for puppies, kittens, and adults. Parasite prevention consultations and fecal testing, dental cleanings and oral health assessments, minor illnesses like mild ear infections, small skin bumps or rashes that developed gradually, mild limping that's improving on its own, vomiting or diarrhea that's mild and your pet is still eating and drinking normally, weight management and nutritional counseling, chronic disease monitoring, like diabetes or kidney disease where your pet is stable, behavioral concerns and training questions, pre-surgical consultations for elective procedures, medication refills, minor wounds that have stopped bleeding and just need cleaning, any situation where your pet seems not quite right but isn't in distress, decreased appetite for a day or two, sleeping more than usual, minor behavior changes. Your regular vet is also the right choice for follow-up care after emergency treatment. If your dog was treated for a toxicity at the emergency clinic over the weekend, your regular vet should see them for a recheck within a few days to assess recovery and make sure organ function is returning to normal. If your cat had emergency surgery, your regular vet handles suture removal and long-term monitoring. In my experience, building a strong relationship with a regular veterinarian who knows your pet's history is genuinely one of the most valuable investments in your pet's health and your own peace of mind. My regular vet has literally 15 years of context when she examines my senior cat. She knows what's normal for him specifically, not just normal for cats in general. And that specificity leads to better medical decisions and earlier detection of problems. Let me answer some frequently asked questions. Can I take my pet to an emergency vet for a regular checkup if my vet is booked? No. Emergency veterinary hospitals are designed specifically for urgent and life-threatening conditions, not routine care. Most will decline to see pets for wellness exams or non-emergency concerns, even if you're willing to pay emergency fees. Emergency vets triage patients based on medical urgency, so if you brought your pet in for a routine checkup while another pet is actively seizing in the waiting room, your pet would wait hours while critical cases are handled first, which defeats the purpose of going to the emergency clinic. If your regular vet is booked out for several weeks and you need a sooner appointment for something non-urgent, call and explain the situation to see if they can work you in, or ask for recommendations for other regular veterinary clinics in your area accepting new patients. How much more expensive is an emergency vet compared to a regular vet? Emergency veterinary care typically costs 2 to 4 times more than the same treatment would cost at your regular vet during business hours, primarily due to emergency fees, usually around $100 to $200 just for initial triage, after-hour staffing costs, and the specialized equipment and expertise maintained for critical cases. For example, a straightforward wound repair might cost around $300 to $400 at your regular vet, but around $800 to $1,200 at an emergency clinic. Emergency surgery for conditions like gastric dilatation volvulus or foreign body obstruction can easily reach $3,000 to $5,000 or more, depending on complications and hospitalization time. Most emergency clinics require payment in full at time of service or approved financing through services like CareCredit, while regular vets often offer more flexible payment arrangements for established clients. Will my emergency vet send records to my regular vet automatically? Most emergency veterinary hospitals will send discharge summaries and medical records to your regular veterinarian, but you typically need to provide your regular vet's contact information and specifically request that records be sent. It's not always automatic. When you visit an emergency clinic, bring your regular vet's name, phone number, and fax or email information with you. Ask the emergency staff to send complete records, including all diagnostics, treatments provided, medications dispensed, and follow-up recommendations. It's also smart to request a copy of records for yourself, so you have them if your regular vet doesn't receive the transmission, or if questions come up about what happened during the emergency visit. Make sure you schedule a follow-up appointment with your regular vet within a few days so they can review the emergency treatment and ensure your pet is recovering appropriately. Here's the bottom line. The distinction between emergency vet and regular vet services isn't complicated once you understand the fundamental difference. Regular vets build long-term relationships and handle the full spectrum of preventive and routine care that keeps your pet healthy. Emergency vets specialize in stabilizing acute crises that happen outside business hours or can't wait for a scheduled appointment. Both are essential components of responsible pet ownership for dogs, cats, and other companion animals. What I've learned through years of managing my own pet's health and through way too many late-night panics is that the best approach is establishing care with a regular veterinarian you trust. Maintain that relationship with annual wellness visits and prompt attention to minor concerns before they become major problems. Simultaneously, identify your nearest emergency clinic and save that information where you can access it instantly when something goes wrong at 2 a.m. on a Saturday. The pets who fare best are the ones whose owners know the difference between these two types of care and use each appropriately. Without hesitation when emergency strikes, without unnecessary panic when patience and a Monday morning appointment would serve just fine. Keep both phone numbers in your contacts. Know the specific symptoms that warrant emergency intervention. Give yourself permission to call and ask if you're genuinely unsure. That 5-minute triage conversation might be the most important medical decision you make for your pet. Thanks for listening to this episode of Total Pet Parent Podcast. We've got new episodes coming out every Monday, Wednesday, and Friday, so you'll never wait too long for the next one. If this episode helped you out, I'd really appreciate it if you could leave a 5-star rating and write a quick review. I know everyone asks for that, but here's why it actually matters. Those ratings and reviews are how other pet owners who are searching for answers find this show. It's how we reach the person who's frantically Googling at midnight trying to figure out if their dog needs emergency care. So if you've got 2 minutes, that would mean a lot. And hit subscribe or follow while you're at it so you get notified the second new episodes go live. Talk to you soon.